Hi there, this is Ian Wright, and I just want to give a little introduction into concussion and post-concussion or post-concussive syndrome, because I'm just seeing such a lot of it at the moment in practice. I mean, I saw 3 or 4, at least, people last week with it, with the effects of retained concussion, and it's actually a really important subject, and often are undiagnosed or underdiagnosed and can cause a lot of problems. So I'm just going to give you an introduction to actually what concussion actually is and how concussion symptoms in babies and children differ from those in adults, and also what post-concussion states and symptoms actually are. And so if there is something that's retained in terms of concussion in the body, and also how we can sort them out and how we can deal with them, because they're really important. So concussion is classified as a kind of mild traumatic brain injury. It actually means there is a little bit of an injury to the brain, but it's incredibly mild. There's no serious nerve damage or anything like that. But there is something. It usually happens after a whiplash type head injury, where the head and the brain are shunted quickly forwards and backwards. So what happens is the brain is covered by a membrane, a protective leather-like dural membrane it's called, and it has a fluid that protects it, a layer of fluid that protects it. What happens though in a shunting injury, like a head injury or a whiplash type injury, when you bang your head, a lot of them I see are sports injuries, hurling, jockeys, etc., etc. Babies who bang their heads, quite common. Very common. Road traffic accidents, of course, are one of the most common. But what happens is the brain is shunted very quickly backwards and forwards, and it can lead to a little bit of bruising to the brain itself, and it can lead to little micro damage to blood vessels, and also strain on the coverings to certain nerves, like the cranial nerves and other nerves. And this can lead to a kind of altered mental state, which could actually include being unconscious for a short while. The symptoms of this at the acute time are memory problems, confusion, drowsiness, dizziness, vertigo, blurred double vision, headache, nausea, vomiting, often a sensitivity to light and noise. Very commonly there are balance problems, slowed reactions. They're often irritable. The eye pupils tend to either be large or unequal left and right. Sometimes when it's severe there can be a seizure, slurred speech. A lot of people, I'd say half, would have some sort of vestibular disturbance, meaning a dizziness and an inability to walk very straight, a slight kind of level of dizziness, vertigo. Now, concussion symptoms in babies are slightly different because they don't speak and they don't walk. They can't tell you also how they're feeling, and you can't tell if they've got confusion, memory problems, etc., etc., drowsy. Well, they're drowsy anyway. They can be drowsy, actually. That's actually quite common. But the most common symptoms of concussion in babies is they throw up, they're vomiting, they're super drowsy, or if there's any fluid coming from the eyes, ears, or mouth, that's very important. That's an important sign. You need to take them straight away into hospital. Often they're hyper irritable or hyper drowsy. So as you go into children that are slightly older, the symptoms of concussion are more like they're super tired, they're listless, they easily tire, they want to sleep, they're very irritable and cranky, more than normal. Any signs of balance, unsteady walking, excessive crying, change in eating or sleep patterns, or if there's a lack of interest in their favourite toys, these are signs of concussion. But you have to take them straight in for emergency care if the following symptoms happen, which I think are very important. And it's pretty obvious this, but I'm going to say it anyway. If they're repeated vomiting, getting worse, if they've lost consciousness for over 30 seconds, if they have a headache that is worsening, if their behaviour distinctly changes, if they lose coordination, if they get disoriented, their speech is slurred, seizures, if their pupils are large or at different sizes. But the important thing is if their symptoms are actually starting to worsen, if they're not getting better. Now, the thing with concussion is it can develop within minutes of hitting your head or jolting your head, but it can actually come on later, can come out hours later, days later, or even sometimes months in some cases later than the trauma. So it's important to be vigilant, I think, for these kinds of symptoms. Also, which is a very important part of it from our perspective, is when you bang your head or jolt your head, it can be accompanied by injuries to the neck, the spine, and especially the neck, which cannot be seen. It's very important, especially the very top of the neck is an area that needs to be evaluated. And if there's any what concerns about it, they need to be scanned straight away. I sent a child off last week for an upper neck scan because I was concerned about the upper neck. The symptoms can vary with each person, and also if there's a pre-existing issue, for example, tendency to headaches or tendency to vertigo or behavioural issues, say in a baby, it can just worsen those types of things. It can accentuate things that are already there. That's often okay. One thing we have to be very aware of is second impact syndrome, which is an accumulation of damage. You have the first impact, they're not quite recovered from it, and then they bang it again, which is actually very common in people like jockeys who are always falling, or rugby players. It accumulations of concussions, what I see a lot in sports people and sports injuries. Very important to treat these. So, how do people test for concussion? Normally, it's a variety of tests. It's 4 or 5 different tests, which one of them is neurocognitive, meaning memory, reaction time, etc. Testing someone's balance, and to see if they're with their eyes in the horizon, if they lose their sense of balance when they're standing, and if they're moving at all when you get someone to stand, if they can hold their midline, and visual tests to do with pupil size and pupil reactions. In the normal treatments, and people are starting to get much better in terms of in medical terms, in terms of treatments, where they start to get vision therapy, vestibular therapy. The other things that are very obvious that need to be done is if you're a sportsman, you can't play sports. We don't want any accumulation at all. You avoid stimulation. It's that sitting in a quiet room, eating well, keeping your fluids up, avoiding strenuous exercise. But what I really want to talk about here is post-concussion syndrome, which actually is incredibly common and much more common than realised. I'm often diagnosing a concussion in a child or a sports person that they may have even forgotten about, but you can feel it because they're having these mild symptoms. And it's a hugely important part of our work, I think. Some of the symptoms of post-concussive syndrome are headaches, dizziness, vertigo, low-level fatigue, difficulty with short-term memory, difficulty with concentration, insomnia, restlessness, irritability, apathy, depression, anxiety, slight changes in personality, sensitivity to sounds, loud noises, and to light. These can be very subtle, but they can be there. The way that we diagnose it is actually to feel what's going on in the head. Osteopathic, we have to evaluate the direct damage to the bones, but also evaluate the mechanics of the upper neck, because that's often involved. And then what happens is, what we feel is that actually the membrane, the dural membrane which is protecting it, has a degree of fluidity into it, and it shuts down, it locks down, and the fluid, the CSF, cerebrospinal fluid, tends to shut down in its freedom of movement. Everything is just not as fluid and as free, and we free it all up, and I think it's incredibly effective, and one of the best things you can do that I know of for post-concussion syndromes, or even a concussive process, if you're very gentle. Obviously, when someone's had an acute head injury, you have to evaluate if there's any actual nerve issue. But in some of these areas where everything's just got shut down, very gentle fluid treatment is, I think, incredibly important and can have a really good effect on all these kind of post-concussive syndromes. There's also, I think, what I would call more of a kind of the spinal cord can sometimes have a concussion, not even if it is the brain. It can have this kind of jolting and shut down in the dural membrane, which covers not just the brain, it covers right down through the spinal cord and attaches right onto the bottom of the spine at the sacrum and coccyx. That can get locked down and cause problems at the other end, for example. So you don't want this dural membrane locked, because it basically can cause headaches, can cause back problems, neck problems. It's very important in terms of, and also because of the natural fluidity which actually feeds the spinal nerves as well. It needs to be maintained. So there you go. That's a little introduction to a very important subject, and I just see so much of it. Anyway, I wish you well.